So, Nay, why don't you tell us about the exciting research that you're doing, especially with chronic low back pain, spinal stenosis?
The therapy I have been studying is called Cognitive Functional Therapy, or CFT. It is a physiotherapy-led intervention based on the behavior psychology and neuroscience direct to the physiotherapy practice. So it's a mix of those areas, and it's a behavior approach that can be delivered by physiotherapy. Consider the evidence, the scientific evidence we have for that includes all this evidence to treat patients with chronic low back pain. And there are three main components for CFT. The first is making sense of pain, which is a process of listening to patients' stories and trying to understand all the the interaction of biopsychosocial factors. The second one is exposure with control. For example, if a patient has maladaptive functional behavior related to bending over, so we are going to try to help them to do the same movement in a more relaxed way, trying to recover his or her natural way of doing without muscle guarding and without increasing pain. That's why it's exposure with control. We have to check whether they are contracting abdominal muscles, because we know this kind of protection decrease the pain threshold. Then the third component is lifestyle change. We know that sleep disturbance, obesity, lack of physical activity, we know that smoking, all these aspects, they contribute for a low pain threshold.